Well, geographic atrophy is one advanced form of age-related macular degeneration, of AMD, and it consists of loss of the photoreceptors and the retinal pigment epithelium in the middle of your retina, in the macula, and that's the part of the eye that's responsible for reading, face recognition, color recognition, and it's devastating for the patient who suffer from it because they lose many things that are important for their daily life, such independence, reading, getting around by themselves. So the disease burden is extremely high, and it's growing because it normally occurs with older age, and as we're getting all older, more and more patients are expected in the future. Well, GA is a multifactorial disease, but there's a lot of evidence that the complement system, which is part of the innate immune system, plays a relevant role. For example, parts of the complement system have been found as deposits in drusen, which are kind of deposits that we usually see in intermediate AMD before geographic atrophy or other advanced stages of AMD develop. And they are also found in the choriocapillaris, and there seems to be a dysregulation of certain complement factors observed in geographic atrophy. And there also seems to be a genetic risk, so there are basically patients who have a higher genetic risk because they have mutations in their complement system, and they really have a strong correlation with geographic atrophy. So that's known. This allows us basically to tackle the problem by inhibiting the complement system. And that's that type of therapy where we have the highest hopes at the moment to stop, or at least to slow down this process by inhibiting certain complement system factors in geographic atrophy. C3 and C5 are part of the complement system, and basically they are part of all this resistance. So the alternative, the classic, and the lectin pathway, they all merge as C3. And C3 basically is cleaved in S3 and S3b, and activates further downstream other complement factors to form the membrane attack complex. C5 is in between. C3 has a kind of mixed role. On the one hand, C3 is activating C5 and then further on the membrane attack complex. But the smaller part, when the C3 is cleaved, also helps against pathogens, so it's against bacteria. So you may argue, if you inhibit C5, it's probably a little bit safer, maybe better, because you will not hamper around with the positive effect of the cleaved C3 that is against bacteria. The dysregulation, it is thought to be one crucial factor for the progression of geographic atrophy, and also for the development by itself too. And this allows basically a therapeutic approach, so that you can inhibit this dysregulation by shutting down certain factors with the hope to stop, or at least to slow down the propagation of the disease.